Hello, I'm Dr. Michael Schick. I'm going to give you another example on how we can bring biochemistry to the bedside by using ultrasound. And in this example, we're going to be talking about ultrasound of a joint. And you can ultrasound a joint for many reasons. It could be fracture, inflammation, infection. But as a specific case, we're going to talk about gout. Now, gout is a type of inflammatory arthritis where you get overproduction of uric acid, and you can also have reduced excretion of uric acid. Altogether, that will create hyperuricemia. Now, all that uric acid can consolidate and form urate salt crystals, and they're going to form these beautiful needle-like crystals that you see on your left. Now, white blood cells will go and try to ingest these, and they'll actually burst those white blood cells. They'll release all sorts of inflammatory markers and create a cascade that can create painful joint inflammation that will lead to pain, swelling, and what you see on ultrasound is a joint effusion. Now, a joint effusion can be caused by many things, and in the situation where you don't know what's causing it, you want to make sure it's not an infectious etiology. In this case, we know it's inflammatory because we're talking about gout, but the only way to really do that is an arthrocentesis, where you put a needle into that joint space and get some fluid out for analysis. Ultrasound is great because it'll answer the question whether they have a joint effusion or not, and that will change your decision of whether you want to try to put a needle in it and do an arthrocentesis. And it should also lower or raise the probability in your mind of whether this is an inflammatory and or infectious process. Luckily, joint effusions are easy to identify. You just put the high-frequency ultrasound probe right on the joint space, and when there's no effusion, you just see bright white bone underneath soft tissue, and it tends to shadow underneath the bone. If there's fluid, it's going to look like black or anechoic fluid around the joint space right on top of the bone. That's consistent with an effusion.